Hello, everyone. Welcome to lecture. We're going to talk in this part about the subdisciplines of the exercise sciences. I think a more formal way to say it are kinesiology subdisciplines, but we are in the school exercise and nutrition sciences, and our disciplines are typically more associated with exercise. So if you were to Google the subdisciplines of kinesiology, you would probably come up with a combination that would include these list of disciplines or subdisciplines. We're going to take a look at each of these subdisciplines, but as we talk about your coursework, so we're going to, at the same time we learn about what we study in kinesiology and exercise science, we're going to look at the classes that you take that correspond to those different subjects. I wanted to just kind of show you guys some of the top tier kinesiology programs, just showing you an overview of some of the coursework that they require. And just essentially it's very similar to yours. You have courses like exercise physiology, you have classes like health promotion, motor skill learning and acquisition. I'm sure there's a biomechanics class on here somewhere, biomechanics of human motion in third year. So essentially I'm just highlighting to you that kinesiology programs are one and the same in that if they have any kind of emphasis in exercise science, they're going to require this type of coursework. This is another one that shows just the same kind of thing. We've got anatomical kinesiology, which I'll show you what that corresponds to here. Basic human nutrition, which you guys also do. Exercise physiology, again, biomechanics for sport and fitness, and all sorts of different iterations of these subjects. Like this one has exercise, this one's nutrition and sport biomechanics, and ours is just general human biomechanics. So different programs will have different emphases, but same core subdisciplines. Here's another example. This is another program that has the exact same kind of coursework that we do. Another one, wow, I really got excited. And eventually I get to what you would find if you were to Google on the internet, subdisciplines of kinesiology. This is actually from probably the best-selling textbook. And since we don't have one, the best-selling textbook, this is the image they use to represent all of the different disciplines of kinesiology. And that is, I think it's a Hoffman text. I couldn't tell you the title if I had to. Intro to Kinesiology, I think. One of the courses that you'll take is Intro to Sports Medicine. And in this course, we're hoping to just show you some of the general injuries that we're going to be dealing with in doing rehab and athletic training for sports. So you'll learn all about the different injuries, again, the most common ones, and not only how to diagnose them, but how to treat them. So the tools and modalities that we use to treat them, and some basic protocols. Some of them you're probably familiar with already, and especially if you've gone through any kind of a high school athletic training program. It's the basics, the bracing, the taping, the splinting. But the way the course is organized is really smart. They just start with joints and go up. So they just do the toe, the ankle, the knee, the hip, and it's really just nicely organized so that students have a good time compartmentalizing the different common sports injuries. So I have up here something about the MSAT, and that stands for the Masters of Science in Athletic Training. And this is a program here on the horizon, but at lots of other campuses, where you can apply to the athletic training master's degree because it's required to have a master's by the time you're finished with school. And in the case that you were interested in applying to a master's in athletic training, we could enroll you in ENS 265 lab, which will be a prereq for grad school to get into an athletic training program. So talk to your advising team, which is us, if you want to get into the ENS 265 lab. We'll have to manually add you to it. This is a quick video to show you about the 5 common sports injuries. So you're going to learn about these, and again, you'll learn them in a very systemic and very anatomical way, but just to give you a glimpse of what you'll be learning about.
Runner's knee. Runner's knee is a condition characterized by pain behind or around the kneecap. It is caused by overuse, muscle imbalance, and inadequate stretching. Sprained ankle.
1-0 in the 37th minute. She is between 2 Guatemalan defenders and then goes down and stays down, and you will see why.
The ligaments of the ankle holds the ankle bones and joint in position. They protect the ankle from abnormal movements such as twisting, turning, and rolling of the foot. A sprained ankle happens when the foot twists, rolls, or turns beyond its normal motions. If the force is too strong, the ligaments can tear. Meniscus tear.
And I think some of it was just being scared. But this guy, just like you want to go after Patrick. And
each of your knees has 2 menisci, C-shaped pieces of cartilage that act like a cushion between your shin bone and your thigh bone. A meniscus tear happens when you forcibly twist or rotate your knee, especially when putting the pressure of your full weight on it, leading to a torn meniscus.
But an
Rotator cuff tear.
He has a torn rotator cuff. Kobe traveling to Los Angeles today to be examined by team doctors on it.
The rotator cuff attaches the humerus to the shoulder blade and helps to lift and rotate your arm. A rotator cuff tear is caused by a fall onto your arm or if you lift a heavy object too fast. The tendon can partially or completely tear off of the humerus head. ACL tear.
Here's Rosario on the break now, and watch. Nerlens go up with a left hand, block the shot, and then on landing, there came
The ACL runs diagonally in the middle of the knee and provides stability. Anterior cruciate ligament tear occurs when your foot is firmly planted on the ground and a sudden force hits your knee while your leg is straight or slightly bent. This can happen when you are changing direction rapidly, slowing down when running, or landing from a jump. The ligament completely tears into two pieces, making the knee unstable.
So I had to cut off that fabulous demonstration of sports injuries, but when I have a live class and I poll you guys, it's crazy how many of us have had ACL injuries. I was a high school and college athlete, and I know tons of you guys just came from high school athletics and even college athletics at the community level. And seriously, the ACL tear rate is pretty crazy with once you get to that higher end or past your elastic growth youth phase. So you will take ENS 265 lab intro to sports injuries before you take applied kinesiology, which is ENS 303. This course also has like a super critical prereq of anatomy. So you have to take bio 212 or anatomy elsewhere before you're able to take applied kines. And the reason why is because they're really going to take your knowledge of anatomy and marry it to studying sports, which is fun because we get to, anatomy is not the easiest class, but we finally get to use that knowledge to something we enjoy, and that's analyzing sports movements. So these are just some terms you'll see to study joints and ligaments and muscles and tendons and become familiar with those terms. But some of the things you'll learn is about the differences between different stretching mechanisms and some of the outcomes and benefits of stretching and some of the outcomes of not stretching. But you'll also learn about how to analyze very carefully using that anatomy knowledge. And I have a really good video example of the way and some of the way that this course will look. This is a project for the course.
The athlete takes off the ground, the hips are extended, both knees are flexed, the ankles and plantar flexed. On the right arm side, the shoulder rotates posteriorly upward and abducted, the elbow is flexed, the wrist and fingers are extended. On the left arm side, the shoulder is flexed, the elbow is extended, and the wrist and fingers are extended. All muscle actions are concentric. On the right arm, the shoulder, serratus anterior, abducts and rotates the scapula upward. Trapezius and rhomboid elevates, rotates upward, and moves scapula medially and backwards. At the elbow, biceps brachii, brachioradialis, and brachialis flexes the arm. At the wrist, extends.
So you guys get the point. And I have kids at pretty much all levels of grade school through middle school, and I know that you guys are familiar enough with anatomy. If you haven't had anatomy here at San Diego State, or already at college level, you're familiar enough to recognize terms in there that are anatomy. Concentric, eccentric, they're naming the names of the muscles, and origin and insertion points. So you're taking your knowledge of anatomy, whether you have a lot or a little, and you're applying it to analyzing sports movements. It's a pretty cool class. You have to do that class, super hardcore rule about that prerequisite sequence too, but they really like if you have your applied kines class done before you do biomechanics. And the biomechanics itself is just basic application of math to study of human movement. But they use, sports analysis examples so that your experience in doing that is helpful. I think they're okay with concurrent enrollment too, but it's helpful to talk about these sequences also. You'll have these questions as you matriculate into major. So biomechanics, the studies the laws and principles of mechanical physics and how to optimize human movement. And that's an important part we'll talk more about when we get to talking about ENS research. The goal of biomechanics and ENS research is to optimize human movement, to make it as efficient as possible, to make us, less prone to disease from hypokinetic diseases and things like that. So biomechanics, the study of and evolution of. So biomechanics actually has an old start. We've all seen this image of the Da Vinci's picture of man. And I don't quote me on it. It's been a while since I've read what this is actually about. But I think Da Vinci was the first guy to discover that the joints center on, this axis. And so we have all these circular and perfect joints on these centers of rotations. So this image is important in biomechanics because it's founded on using physics to describe human movement. And then it expanded big time in the war, and you guys will laugh at this, but well, maybe not. It's not that funny. But when people lost limbs, so it really took off when we expanded with the partnership with engineering and people that did prosthetics. So then people were really interested in how the math of human movement could be applied to engineering and prosthetics, and that became a big, commercial and needed industry. So big expansion in the wartime, and then we saw, again, just as an academic discipline, it expanded a lot in the 70s, and still now we see tons of different academic programs being born. We'll talk about one later, but USC Keck, they have a biomechanics program, which again, it's hopefully they're funneling in their physical therapy students from that biomechanics undergrad degree, but very up and coming subdiscipline of exercise science. I forgot I put this in here too. I should review more carefully my notes before presenting, but Dr. O'Connell is our biomechanics guy, and he has a neat background. You'll take him for ENS 306, which is our Intro to Biomechanics class, but I like to introduce him to you early because you can have a good idea of what he does for research and impress him when you meet him. He has a neat bioengineering background, and he's kind of in the idea of doing the engineering stuff first and then backing into biomechanics, but he'll talk with you more about that. So biomechanics as a topic, some of the things you'll learn in your biomechanics courses are just basic physics concepts. You'll be reminded of what you learned in your physics classes if you have them. Not all of us listening to this required physics. But things like torque, inertia, velocity, trajectory. And when I say, things like force, things like compressive forces and how that applies to when we run, and those compressive ground reactant forces, where do you think they go? Right into our knee, and how our body and bones handle that. So you'll learn about all of these physics concepts, only now instead of just like plain boring pendulums, you'll be learning about how we move. I'm going to show you guys a couple examples of videos that really sum up the rest of what these bullet points are. Some of the different tools and instruments that we use to measure the biomechanics of movement, things like joint angles and EMG or muscle activity machines. I'm going to show you some videos that demonstrate how biomechanics is used, some of the instruments that are used in different settings. So I'm going to show you one in sport, I'm going to show you one in clinical or surgical, like biomedical settings, and then I'll also show you one in the clinical gait, I'm a runner kind of fitness setting. So this is first in the sports setting, how we use biomechanics to analyze sports performance.
In one of the third innings, Chapman threw 25 pitches, and every one of them was clocked at over 100 miles an hour. But how does he do it? Pitching coach Tom House has worked with some of the game's hardest throwers, including Nolan Ryan and Randy Johnson.
What you have here is a CC Sabathia upper body and a Randy Johnson lower body. That's why he throws 105 miles an hour.
First, his stride. The typical stride length for a pitcher is about 87% of his height, but Chapman's stride averages 120% of his 6'4" height, approaching 7.5 feet. His stride isn't just long, it's fast, taking only 0.8 of a second, 15% faster than average pitchers. Next, shoulder turn. The twisting angles between his front hip and his back shoulder create massive torque.
80% of velocity comes from hip and shoulder separation.
Elite power pitchers like Randy Johnson create angles of 40 to 60 degrees, but Chapman's is close to 65 degrees. Next, delivery.
So I'll post these videos for you guys in Blackboard so that if you wanted to watch it because you just love Chapman and you want to watch the rest of that video, you can. You can tell it's old by his uniform. But I'm really showing them to give you an idea of how biomechanics is used. You just heard, if I could move this, which I probably can't. I can't. But you could see the word force, you could see the word velocity. Those are the words that we're using in the field to characterize pitching performance, which is, by the way, pretty valuable. It's big bucks. So here's an example of how biomechanics is used in a clinical or biomedical setting. And we're probably not going to watch the whole thing again. I'll post them for you.
The glenohumeral joint is composed of the humerus and scapula and is the most mobile joint in the body. The motion of the humerus relative to the articular surface of the scapula, the glenoid, is described as spinning sliding, and rolling. Shoulder motion and stability works in proportion to the perpendicular moment arm.
Yeah, let's get
The
to some
larger
math.
the moment arm, the greater capacity for that muscle to generate the torque required for motion
there's
and
torque
support
again.
external loads. The location of the moment arm relative to the center of rotation determines the type of motion the muscle creates. Rotator cuff tears have negative consequences on motion and stability. As the rotator cuff fails to balance
Number
the
two,
deltoid,
sports
the
injury,
humeral head migrates
rotator cuff.
superiorly
Common thing,
and
guys.
impinges with the acromion, leading to further tearing.
Ouch.
The standard of care for CTA is reverse shoulder arthroplasty. The reverse shoulder prosthesis inverts the anatomic articulation, making the glenoid convex and the humerus concave. Inverting the concavities restores stability by creating a fixed fulcrum that prevents superior migration, facilitates the deltoid to elevate the arm, and limits motion to only spinning. Inverting the concavities also causes an inferior medial shift in the center of rotation and position of the humerus. This dramatically alters the relationship of each muscle relative to its normal physiologic function. Medially shifting the center of rotation increases the length of the deltoid abduction moment arms, improving its efficiency to elevate the arm. However, medially shifting the humerus shortens the rotator cuff muscles, which has negative consequences on...
Doesn't look very good. I watched that for longer than I should have because it is interesting how they can just break down so well how the math and the physics are going to relate to the way the arm has function and the way it looks even, which is where they were going in the next segment. So this is an example of how this is actually a cool commercial business video. So someone has a high-end clinic where they have all of these nifty tools, and this is really the one where it kind of features the tools that we use in practice. You can see up here an EMG, which is essentially measures the activity of muscles. You can see force plates, which is where you're going to see his footprints go down. You can see his digital avatar, which shows his skeleton. And these are the kind of tools that we can use to biomechanically study, maybe in this video, someone's gait and get to that problem of why they're having problems and pain when they're running. So again, I won't keep you long in this video, but you can see exactly how this exercise science biomechanics expert uses these tools to work and make money.
This is a 42-year-old male who is a high-level runner that came to me recently with complaints of pain in his anterior right hip. First thing we'll take a look at here with his EMG, and we were both surprised to see that his left one was firing a little bit more than his right. We're going to be able to explain the clinical relevance of that in just a second. Second thing, we jump down to the group of the hamstrings. You can see that left hamstring is activating more than the right side. The only thing that really jumps out to me right away is the difference in his right foot coming off higher than his left, and that has to do with the amount of, in his case, it's actually the amount of overactive hamstring. But this is really significant because his left foot strikes on the left side of the rehab. Look at
Look at this part is
when he
poignant.
strikes down right
The hip.
here. Watch his pelvis.
Wow.
It just drops. Not only that, but he also has a fair amount of lateral trunk lean on that left side.
Mm-hmm.
And that
So,
all,
just to give you guys an idea, again, I'm not asking that you memorize the details in these videos. These are just to demonstrate when I say that, biomechanics is now being used. This particular subdiscipline is used in these fields. You'll have an idea of what I mean. Because when we build on this and we get to the ENS practice professions, we'll talk about what biomechanists do in practice. And of course, these things will come up. You'll also take a course on motor behavior, which is sometimes also called, different schools call it different things: motor learning, motor control, sometimes motor learning and control, motor behavior. But essentially, it's kind of like a course about how your brain works with your muscles. So this class class, you're going to want to take psychology first. The prerequisite is Psych 101. And the reason why is because you're going to learn some basic physiological concepts about how the brain works in that class that's helpful for them to pick up from in ENS 307. The study of motor behavior is, again, looking at 3 separate disciplines that were formally made into a subdiscipline just recently in the last 30 years. Before that, it was actually just branched off of abnormal psychology. We were interested in looking at how the brain and its plasticity, meaning that if we work with it, it gets better and better, as the image is kind of representing. We create better neuron strength, and we also create more neural drive. And we know that, but we would like to look at abnormalities in that. And so the study of this really was birthed out of problems with it. You know, why can't people that learn how to drive, why don't they automate that like the rest of us do? So abnormalities in motor learning and motor function. And we even have faculty that specialize now in dysfunctional motor control. What happens if you're subjected to certain types of diets, or in his case, he settles fetal alcohol syndrome. So in the case of in utero, subjected to alcohol exposure, how does that affect your ability to learn and retain learning, which is the study of motor behavior? It's important for us to know that as exercise scientists. Also, I wanted to say too, and maybe I can talk about it on this slide. Actually, perfect. I have the bullet point pedagogy. And what I mean by this is exactly that. We need to, as exercise scientists, understand how to teach people how to move, whether you're doing physical therapy, PE, which is physical education, whether you're a coach, whether you're a strength and conditioning expert, we have to be able to talk with people about how to use their muscles. So we have to understand how people learn that process. You'll read an article in part 2 about should we help people across a narrow beam when they're learning to walk one or not? That's a motor learning area of research that helps us as, again, trainers, coaches, as strength people. Do we do that or not? And there's people that do research in motor learning and motor behavior. How do we learn best? How do we retain that learning best? This is another fun little video that I use to demonstrate the concept of practice, which you will learn in your motor learning class. Lots about practice. What is the difference between practice and conditioning? What are the stages of practice? So we have these very calculated stages that we go about practicing, and the outcome of practicing learning. We acquire skills in this very, again, known and methodical fashion. And so this little video shows a guy for his project in his motor behavior class showing himself learning the mushroom circles. And it shows the stages of learning. Coach demo. That's a lot harder than it looks, by the way. That's good. I think it gets a little better, but I'm calling that because you get the point. And if we back up a little bit, you can see with the stages of practice that, you know, in a quick summary, he went through that whole, lots of errors. It was clumsy and inefficient all the way till he had less errors. I wouldn't say he made it to this autonomous stage, but he was in here in the associative phase when we left off. So you kind of get the concept is that we have these stages and we watch demos. And again, it helps us teach people how to do physical activities and exercise. So you'll also take a course called ENS 305, Measurement and Evaluation. And this course, got to take stats first because you're going to build on your basic stats knowledge and how we analyze human movement for research. So I mentioned before, we do a study to see if it's better to walk someone over with their hands on a balance beam. How would we quantify that? So you have to take a course about how we do the statistics in the type of research that we do. And I'll give you the simplest example I could think of in just a second. Let me forward through all this stuff. So some of the themes that you'll learn about in sussing out the different ways that we analyze exercise science data, you'll learn a couple different themes. One is going to be about validity and reliability, which it's probably early on to split those two concepts, but essentially it means like, how good is your data? You're doing research, you're collecting this information, how good is it? All data has like some amount of limitations to it and some amount of assumptions, guessing, grabbing. So basically this class looks at the statistics about the quality of the data. So you're going to learn about accuracy and precision, and you may know what these mean already, especially if you already have had stats, but accuracy in terms of like, if the bullseye is the target, how close were you to the target? That's your accuracy. If you had 5 darts and your target was the bullseye was the target, and you threw it pretty close to the same spot, but nowhere near the target, that's called something that's precise, but not accurate, right? Because they were close together and they were repeatedly close, but not close to the actual target. So there's different terms that are going on here, but you can see just at a glimpse, precise, accurate, and neither precise or accurate. And these are the kind of things that you're actually going to learn how to quantify, how you're going to turn these, just really loose visual concepts to math. And I'll show you an example. And again, very easy examples. We quantify how to body fat, right? We know that. So especially in the fitness industry, we quantify how much body fat people have. We can turn that into a mean, and then we might want to quantify if the method that we use, and in this example, it's DEXA, which you haven't learned about that yet, but it's the gold standard. It's like hydrostatic weighing, which is where you weigh yourself in water and your fat gets displaced and you can calculate your lean body mass. But DEXA is like that, only you don't have to get in water, which is nice. So DEXA is a way that we measure our body fat. And to look at the quality of that data, we could calculate the variance. So we did it 5 times on this lady, and in that 5 times, the standard deviation was so low. She had a mean of 40, but the variance on that was only 1.6. That's very tight, very close to the mean. And so since it has a very low coefficient of variance, we could say that, yeah, that data is precise. And so again, DEXA, high quality data. On the other hand, we're using something like Skinfold. We know that these aren't as good. They use them in gyms. They're cheap. They're fast. They don't take any qualified or trained technicians. So you can do them right away. But of course, they're not as reliable, right? You're going to get a way bigger coefficient of variance. So every time you do it, it's going to be a little different. And you're also not going to get something as close to the bullseye or as accurate. So when we look at something like a Skinfold assessment, we're looking at a coefficient of variance way high, like 25%, where over here it was less than 5. You're also going to take in your coursework pathophysiology and exercise programming for disease populations. And this is a hard course load because it comes together in a set. 332 is 3 units, 333 is 2 units. So you take them together, and it's 5 units of pathophysiology, which means how diseases manifest and how they onset. So mechanisms of disease. You're looking in the picture at cardiovascular disease, let's just say, or atherosclerosis. So you'd first learn quickly about the process or pathogenesis of that. Cholesterol sticks to the arteries, the cholesterol oxidizes, the narrowing of the artery causes lack of flexibility in the artery, endothelial dysfunction, heart attack, stroke, and then you get to the part where can they exercise? And if so, you're the expert that prescribes them the exercise. So you'll learn about how the disease is onset and what it means, and then you'll learn about the legal ramifications of prescribing exercise. Can you do it? What kind of insurance do you need? What are the conditions and ethical standards that they use to prescribe exercise to people with diseases? And then you'll do health risk assessments. And this is, for us, consists of doing what are called exercise tests. So stress tests, EKGs, any kind of test where you're looking at someone's cardiorespiratory or cardiomuscular capacity. You'll also learn about the health risk assessments that you'll do. So the different exercise tests, things like stress tests, where they'll put you on a treadmill or they'll give you some kind of chemical that induces some or elicits some kind of exercise response. They'll take your heart rate, EKG, and do all these kind of tests to determine if you're able to go back to exercise. And if so, what are the guidelines for the exercise? Moderate intensity, supervised, unsupervised, and again, the legal ramifications for that. So this is a neat class that builds on exercise physiology. So we already talked about that course, but you have to have a good understanding of your chronic and acute adaptations to exercise. What happens when we start exercising? What happens to our vessels? Because that's going to be important for someone with atherosclerosis, which is vessel diseases. So pathophysiology. You're also going to take a course, it's kind of a neat blend. It's got a lot of behavioral science elements, but it also has a lot of neat rehab and clinical physical therapy stuff. This course looks at the aftermath of someone who might have been really like an elite athlete. What are their psychosocial responses to their injury, or they're now disabled? What are the different theories about how to treat those patients, and what are some of the different schematics that they go through? What are the different thought processes and stages? You'll also take a course in, actually, This is where we end the road with, actually, we don't end the road there, but we don't have a sport and exercise psychology class. So far, this is the first one that you don't have a course, but it's certainly an important subdiscipline of kinesiology. So we wanted to talk about it. Lots we know about sports psychology. And if you're interested in doing something like this for graduate school, you can focus on a sport and exercise psychology program for your assignment, where you have to look up the requirements for a grad program. The concentrations and things that we know about sport and exercise psychology is that there's been a lot done in mental health. We know that exercise specifically, so not so much on sports performance, but exercise helps with anxiety, depression, reduces medication, improves mood, all sorts of things, improves confidence, all sorts of underlying factors related to depression and anxiety. We also know that, back to sports, we know that athletes aren't a particular type of personality. They're all sorts of different personalities, but one of the most pressing common traits that elite and successful athletes have related to their personality is that they don't mind losing. They have a better ability to cope with losing. Better loss mechanisms, better bounce back. Self-motivation and exercise adherence. We have a faculty member who studies this. She looks at, what happens to people and their motivation levels and how that really projects or predicts whether they're going to comply to their exercise program. If they're confident, they do. If they're not, they don't. And these are things we know, but we still need people to quantify these things to fix this problem. What motivates people. And then one big area, and I think most of the students that talk to me about being interested in sports psych are interested in this, but performance strategies. Things like, I want to help athletes get ready for their performance or cope with different stressors that may inhibit their performance. But I have a good TED Talk little piece on what some of these different methods about self-talk and imagery, just neat mental techniques really successful athletes use that work.
Of the optimal performance. Imagery and self-talk are part of that, and we'll get onto those in a moment. Feedback is clearly important as well. Positive feedback from the athletes' coaches. Imagery is a mental rehearsal, and it's a strategy that many athletes use. And here's the kinds of things that an athlete or a coach will go through when they're rehearsing a performance. It's almost like a video of their performance. They will also use prompts, but they will also visualize any contingencies that arise. For example, any barriers or problems or difficulties that arise during the course of their competition. Here's an example of these kinds of strategies in action. This is Blanka Vladic. She was a former world champion, high jumper, and IAAF Athlete of the Year. And she was very famous for going through the same performance routine prior to a competition. She would close her eyes, visualize a successful jump. She would clap her hands rhythmically and use the audience, get the audience on board. And that would both boost her motivation and her confidence. And then she would practice some moves shortly before executing her jump. Self-talk is another strategy that athletes use. It's an extremely important strategy because it enables athletes to go through in their minds and use mantras to try and boost their motivator. Here's a good example of somebody using those techniques.
I'll post these videos for you guys. I realize this video is getting long itself, so I don't want to watch too much embedded content. But I looked up at the hat and I remembered an interesting point about sports psychology. Just a neat little thing for you people that like history. We don't have a lot of sport and exercise history classes. Sport and exercise psych was born out of the Chicago Cubs. So Major League Baseball had its first official sports psychologist. His name was Coleman Griffin, and he wrote a book on coaches and all the drama, psychological drama that coaches have with their players. And then he turned in on the players and all the inner conflict drama that they have with their coaches. But he wrote a couple books, but he was a consultant for the Cubs. And so that really was when they started looking at, wow, we can kind of analyze and pinpoint commonalities in the way that athletes and coaches interact with each other. And again, to target and fix and improve. That's what we do in research. We solve problems that exist. Sport and exercise. So we, again, don't have this class that's required, but you'll get a little bit of sociology in your ENS 438, that psychosocial class I mentioned earlier. Some of the concentrations or areas of research and study in sport and exercise, so gender and inequality in sports, children's sports and desegregation, meaning how they split up boys and girls, again, going with sexuality and gender, but even bigger picture with the top one. race and religion in sport, why some cultures participate in certain physical activities, why some don't, why some exercise more than others. We have a faculty member here who is heavily involved in looking at religiosity and exercise and physical activity performance in schools. So we'll get more to that in part 2. I don't want to spoiler alert. Socioeconomics and research and participation. This is an interesting one too. Certain income brackets do certain physical activities, certain income brackets do others, and this creates gaps and overall physical activity levels. Also, the study of sports sociology includes the study of sports delinquencies, performance-enhancing drugs, commercialization, mass media, which is the next one, violence, and all that kind of goes together. But there's a lot of gambling and different, ethical issues that go into the social part of sports. We all love them, but there's a lot of social aspects. And sometimes students in, the whole point of this, sometimes students in kinesiology study that and gravitate towards that. All of you also will take ENS 388, which is a course where you're going to learn all about diseases and physical disabilities, both those that are congenial, like you're born with them, and acquired, like from, say, an injury or some kind of fatal accident or disease. You'll learn about client support and goal setting and with real clients. So we have a campus setting, we have a big facility, and we have a very reduced fee. It's like pretty inexpensive monthly for the clients to come in and work with you guys. So you'll get to learn about how to work with populations that have disabilities and learn if you have a knack for it. And really also fine tune your knack if you do. You'll also all take a health communications class, which is upper level after you take your intro to comm class. And this is really dissecting and looking at, how we go about improving health issues and how we communicate those to populations. So what are some different things that we do to promote exercise? Do they work? What are the targets of these interventions? Oftentimes they're kids, because that's what we've been on a rampage about for the last couple decades. It'll be elderly people next. We're on a big upswing in getting active older people more active. But you'll learn about those kind of things. What are the campaigns and promotional efforts that we take to get people moving? Now, last thing real quick, and I will keep this short, there is a couple differences. So far, we've talked about exercise science, and it's broadly applied to all of our majors in kinesiology. But you do have a few differences in the courses and subdisciplines that you'll study. Physical therapy, guys, you'll take physics, and you don't have to do that in fitness specialist. You'll take physics, which helps with biomechanics. I'm not sure why fitness students aren't taking it, but you'll take a year of physics with lab, and mainly it's because it's required for PT school. You also have to do one upper division psych class, which is Psych 350. Just throwing out to your physical therapy students out there that if you were interested in applying to a master's in athletic training, all you would need is, let me see, what was it? Oh, never mind. Physical therapy students, you already have your physics done. But if you're in fitness, all you have to do is take one physics class with one lab, and you'll have the physics requirement to apply to a master's in athletic training. Pre-physical therapy students, you already have that finished with your 2 semesters. This is just to kind of show you that you may have noticed that your program isn't any different from the fitness program except for physics. So how am I now ready to be a physical therapist? I just wanted to show up here. This is why you're not getting much in your undergrad program about therapeutic exercise or rehab, or differentiating habituation from rehab, because you're going to get all of that in PT school. So you have 3 years of PT school, and it's the clinical anatomy, the musculoskeletal, cardiopulm, neuro. That's where you need your juicy rehab exercise science. So here you're just going to get your foundation subdisciplines. Now, the fitness specialist students, you're going to take a lot of extra courses, not a lot, but 10, 12 units extra on fitness assessment and fitness programming. So learning about things like what are the gold standard protocols for determining someone's 1 RM or their VO2 max, which is the amount of oxygen they can consume. So looking at those different measures and looking at good and bad ones. Kind of like ENS 305, only not looking so much at the actual data and the statistics, but the actual instruments and playing with them. You'll also look at, you'll take a course on musculoskeletal fitness, and you'll learn about things like overtraining, periodization, how to create cycles for athletes. And this is again related to strengthening and conditioning. You'll take several courses related to older folks. So you'll take 2 gerontology classes, and you'll take an exercise for sport and aging class. So it's 9 units right there just on learning about the older populations. And again, I think that the idea behind this was to benefit you guys in practice, because the market here and the market paying and the market with Medicare services and things they're older. And so that's going to be a lot of the population that you're servicing, whether you are doing it in a healthcare setting or you want to just make coin in the fitness arena. You guys also have to do a fitness practitioner experience where you'll go out and get some work in a novel setting and get a little bit of practice in an actual supervised setting area, like a real setting. And you'll also do instructional leadership. So you'll also take a course on how to teach adults, how to deal with death and dying, and that kind of goes with that fitness experience that you have. So, and you'll love your teachers in these courses. They're your capstone or your final courses. So that is all I have for you. Those are the subdisciplines of kinesiology and specifically the coursework that you'll take that relates to those. Thanks for listening.